Hey guys, so we already know that scalp massages can be an effective way to combat male pattern baldness. We've made a lot of videos on this topic already, but let's quickly summarize why scalp massages can make a difference to your hair growth. And then after that, I'll go into the best steps for you to use while massaging yourself to achieve maximum results. Okay, let's get started. Now, if you've been dealing with hair loss for any amount of time, you've probably heard one word repeated time and time again. DHT, short for dihydrotestosterone. This is a male hormone that our bodies synthesize through testosterone via an enzyme called 5-alpha reductase, or 5-AR for short. Blocking the action of 5-AR with drugs like finasteride or dutasteride lowers blood DHT levels by up to 90%. 85 to 90% of men who take these drugs will stop losing hair. The problem is twofold. Firstly, the 10 to 15% of non-responders will continue to lose hair. But more importantly, among the majority who do respond, actual regrowth is generally minimal, barely visible to the naked eye. This alone suggests that there is more to hair loss than DHT, that other factors are involved, that baldness, like most chronic health conditions, is not down to a single cause. Nowadays, if you look at any mainstream review paper on androgenetic alopecia, you will typically see it described as a multifactorial condition. Scientists know for a fact that there are other factors at play aside from DHT. The problem is that they aren't exactly sure how to tie the pieces together. Three of the pieces that you'll find referenced time and again in the scientific hair loss literature are impaired blood flow, inflammation, and fibrosis. Let's briefly look at each one of these in turn. Firstly, men with hair loss show massively impaired blood flow in their scalp, around 2.5 times less compared to men with healthy hair. Topical minoxidil reverses this deficit, but the effect is short-lived, lasting around an hour to an hour and a half after application. Without sufficient blood circulating to the scalp, the follicles cannot receive the oxygen they need to sustain a normal growth cycle and gradually miniaturize. A second finding is mild inflammation in the upper portion of the hair follicles. Its significance is not yet fully understood, but it's very likely that it's causally related to the miniaturization process. The third, and perhaps the most important finding, is the abnormal accumulation of collagen in balding skin, a process scientists call fibrosis. This accumulation can be seen in the form of concentric collagen circles around the follicles, which you can see in orange in this microscopy image. The fibrosis also manifests as a thickening of the so-called dermal sheath, a specialized layer of connective tissue that surrounds and supports the follicles. While what causes this is not yet firmly established, a reasonable hypothesis is that the inflammation generally precedes the fibrosis. The fibrosis in turn reduces blood flow by constricting the blood vessels that penetrate the scalp. The inflammation in turn is likely caused, at least partially, by chronic tension or tightness in the scalp area. The tension is transmitted to the scalp by the two main muscles that connect the scalp, the frontalis muscle in the forehead area and the occipitalis muscles in the back near the base of the scalp. An analysis of the tension the various parts of the scalp experience as a result of the chronic contraction of these two muscles reveals a startling correlation with their propensity to baldness. Areas with the highest tension bald first, followed by those with intermediate, and lastly, those with the least tension. But what all these areas have in common is that they overlie a connective piece of tissue called the galea aponeurotica, or galea for short. The galea anchors the frontalis and the occipitalis muscles to the skull, while simultaneously distributing the tension across the scalp to reduce strain on any specific area. The areas on the back and the sides of the head that fall outside the galea's boundaries never go bald, even in the most severe cases of AGA. An increasingly popular hypothesis is that chronic tension in the galea triggers a cascade of inflammatory processes in the scalp of genetically susceptible individuals. This process, known as mechanotransduction, involves a conversion of mechanical stress into pro-inflammatory biochemical signals. The same process also triggers the overactivation of a signaling protein called transforming growth factor beta 1, or TGF-beta 1. TGF-beta 1 in tandem with an overactivation of DHT then triggers the fibrotic process, which in turn causes the reduction of blood flow we observe in balding scalp tissue. Right now, we basically have two effective interventions to reduce this chronic tension, relieving the inflammation and fibrosis and restoring the blood flow. The first is the injection of Botox to the scalp area. The Botox relaxes the surrounding muscles, leading to a state of prolonged relaxation that can last for weeks or months at a time. The drawback of Botox is that it's a prohibitively expensive treatment. It can only be done at a doctor's office at the price tag of several hundred to over $1,000 a pop. This is not the case with the second treatment, which is manual relaxation through scalp massage. You can massage with your bare hands, making it a prescription-free and inexpensive practice to try at home. Let's see how this is done. Begin by finding where you won't be disturbed and ideally massaging at the same time daily to make sure you stick to the habit. Pick a time of day and stick to it with rigorous consistency. You can massage standing up or seated, but avoid a lying posture, which will impede you from moving your hands freely in all directions. To perform a basic massage, place both hands on either side of your scalp. Grip firmly and move your hands in circular motions, moving back and forth. The aim is to create various creases on the scalp. Move one hand while keeping the other still, then switch. After you've done the sides, you can move your hands at the front and the back of your head. When doing this technique, as well as any scalp massage in general, it's essential that you grip firmly to avoid your hands from sliding over the scalp and pulling off hairs. You don't want to be raking your fingers across your head. After a couple minutes with this basic massage, you can progress to the so-called squeeze or pinch technique. Using one hand, squeeze the skin gently, akin to a pinch. To do this, you oppose the thumb with either your index or middle finger. Your fingers generally should be about an inch or two apart. If your scalp is tight, this might be challenging initially, but it will get easier over time. Hold for a few seconds and then repeat until you've covered the whole head. This portion of the massage should last a few minutes. Next up on your routine is the scalp shake. To do this, grasp the scalp with both hands and shake back and forth rigorously. This will loosen the entire scalp and improve blood flow. Although your arms may tire quickly, persistence will make it easier. Start with 30 seconds and work your way up. You can repeat this routine once or twice daily. Aim to massage for at least 10 minutes daily, making sure the area is treated. Not only is this a relaxing, stress-relieving experience, but you will gradually notice that the routine becomes easier as your scalp loosens up and becomes more flexible. Now, for those of you who want to get the benefits without the hassle, the alternative is the use of a specialized device called the Grow Band. The Grow Band works by inflating and deflating an inner tube that gently lifts the scalp, massaging the entire head with every motion. This means you can get much faster results compared to traditional manual massages where you're generally restricted to one area at a time. The newer generation of the Grow Band Pro, is battery operated and fully automated, removing any effort on the part of the user. Just place the device on your head, adjust it till it feels comfortable, and fire away with the control box. You can start off with the default settings, but the inflation and deflation parameters are fully customizable, meaning you can tweak the settings to your preferences. It's a non-invasive, hands-free solution that can give you results in just 10 minutes a day. Like manual scalp massages, you can use the Grow Band as a monotherapy or combine it with other treatments, including traditional medications like finasteride or minoxidil. The Grow Band Pro was designed and created by scientists and engineers from the University of Bristol and the University of Birmingham in the UK, and has gained mainstream attention after recently going viral on social media. So be sure to head over to hairguard.com to check out some of these case studies and pre-order your own Grow Band today. Guys, that's all I have for you today. I hope you enjoyed today's video, and we look forward to your comments below. Make sure you like, share, and subscribe, and I'll see you in the next one.